I'll be presenting on Prilosec, also known as Omeprazole. So some of the indications this medication is used for, one of the main ones is stomach ulcers and infection caused by Helicobacter pylori. It's also known as H. pylori. This bacteria is a gram-negative bacteria that attaches itself to the epithelial stomach wall, and it secretes an enzyme called urease that turns stomach urea into ammonia, and the ammonia works to protect the bacteria from stomach acid and harsh stomach conditions. If left untreated, it may lead to further damage of the stomach tissue and a condition called gastritis. Another indication this medication is used for is GERD, also known as gastroesophageal reflux disease. It's a long-term condition in which contents of the stomachs are often regurgitated or they flow back into the esophagus. This causes irritation of the mucosal lining, and the reflux is usually caused by relaxation of the esophageal sphincter. Some of the risk factors include obesity, eating heavy meals, especially lying down after eating meals, and stress. So this medication works by decreasing the amount of acid produced by the stomach, and the drug is activated by the stomach acid to sulfonylurea moiety, which binds and inhibits the proton pump, and it selectively and irreversibly inhibits the HK-ATPase enzyme in the peripheral cells in the stomach, and it's available in a capsule as delayed release. It comes in doses of 10 milligram, 20 milligram, 40 milligram, and a tablet as a 20 milligram tablet, also available as an oral suspension at 2.5 milligram and a 10 milligram, and also comes in powder. So important considerations before taking these medications. Taking a proton pump inhibitor, or also known as PPI, is associated with increased risk in infections like C. diff or pneumonia, and also a C. diff associated diarrhea. Inform your doctor if you notice any watery or bloody diarrhea. Long-term and high dose use leads to bone fractures, and your doctor may check your kidney function before starting you on a long-term therapy. Do not breastfeed or discontinue taking this medication, since it's distributed through the milk and it's also a pregnancy C category drug. Some of the common side effects are constipation, diarrhea, may also cause abdominal pain and headache. And some of the contraindications for these medications are if you're known that omeprazole causes hypersensitivity, or its ingredients or any substituted benzodiazole, you shouldn't be taking this medication. Or if the patient is on HIV medications that contain a regimen of rilpivirine, for example, it comes in a combination with Complera and Artemisinin. So some of the guidelines for general administration. This medication should be swallowed whole with a full glass of water and no other fluids, at least an hour before a meal. Do not substitute the immediate release tablets for extended release tablets. Capsules may be opened or sprinkled over small amounts of applesauce and swallowed without chewing. Stop, use, and call your doctor if you have trouble swallowing, vomiting blood, or blackened or tarry stool. In case of a missed dose, take it as soon as you remember, unless it's time for the next dose, and never double up on this medication. Some of the drug interactions that are known for this drug are, the drug is primarily metabolized by the liver, mostly by the enzymes CYP2C19 and to a lesser extent CYP3A4. So use caution when co-prescribing with other drugs that inhibit or induce these enzymes. It may also cause hypomagnesemia, so it may decrease the levels of magnesium. Caution is advised when using other medications that do the same. For example, some of the diuretics and digoxin drugs are known to decrease magnesium. Consider dose reduction in cases of hepatic impairment, and for the Asian population, especially if the patient is going to be on a long-term therapy. and no dose adjustments needed for renal impairment. So for general dosage for H. pylori, either patient would be on a triple therapy or dual therapy. So for triple therapy, start with 20 milligram twice daily for 10 days, together with amoxicillin and clithromycin. And omeprazole should be continued with a 20 milligram daily for 18 more days if the patient had active stomach ulcers initially. And for dual therapy, start with 40 milligram once daily for 14 days, together with clithromycin, and continue 20 milligram omeprazole for 14 more days if active ulcers were present initially. And as far as it comes to GERD, for GERD with erosive esophagitis, start with 20 milligram daily for 4 weeks. And if the patient did not have, they're treating GERD but with erosive esophagitis, start with the 20 milligram daily for 4 to 8 weeks. So in this case, it would be a bit longer therapy. Now, for self-treatment or over-the-counter medications, for treatment of heartburn caused by GERD, you use 20 milligram daily in the morning, and do not use longer than 14 days. And here are my references. Thank you so much.